One of the main things I like to educate patients for about waiting for the test results is that we really want to get the best, most specific treatment for them. We want to individualize their treatment so that they would have the very best outcome. So we need to know what drug their cancer would be most responsive to. Usually the emphasis on having the individualized treatment reassures the patient and makes them a little bit more comfortable waiting. I also sometimes like to tell them that, think about when a plant is growing, in particular a succulent. If you look at it from day to day, you usually can't tell any difference in it. Usually with your cancer, it's going to be slower growing, and you have the time to wait for the 2 weeks, and then we can get you started on the very best treatment.
When I'm speaking to patients about the time it takes to get back the next generation sequencing, I use many little booklets from the Lung Cancer Research Foundation. One of them has like little cartoons. And so during that time, I just continue to reinforce that this is the best thing the doctors need to know how to formulate, I call it the recipe, that would be best to treat their cancer. And I don't really have patients that are concerned about it. Yes, they wanted to start their treatment, but in the meantime, a lot of them still happen to have to get their PET scans. Like all of their staging isn't completed. And I think they almost feel relieved that they're kind of having a little, this is a moment that I can catch my breath and kind of get things together and maybe look at all the information that I've got. So I haven't really seen where a lot of patients are pushing back on why do I have to wait this 2 weeks. They really do understand that this is all for the best so that they do have the best outcome. And it's just, again, reinforcing and being there for them, whether it's via email or phone call or in person. Like even today, I met the patient when she was getting her MRI of her brain just to reinforce what they were told yesterday, because, they have that look on their face like, oh, what was all that stuff? And then I gave them the booklet on immunotherapy. So they were most appreciative, and just gives me the time to reinforce what the doctor said. 2 weeks actually, it may seem like a long time, but it actually goes by pretty quickly.
When a patient requests a treatment that may not be right for them, I like to ask why they're requesting that particular treatment. Like you said, most often it's because they've seen a commercial on television, or they have a friend or a neighbor who was treated with something, or they heard President Carter got pembrolizumab, and so that's what they want. And so I approach that question or that issue the same way I do when I'm trying to explain the importance of waiting to get the sequencing back. And I find that people respond best when we kind of level set. So I take that opportunity to do some education, and we spend time talking about lung cancer in general. I like to draw pictures, or sometimes I'll show them a pie chart of, the percentage of non-small cell lung cancer in contrast to small cell lung cancer. And then I'll try to talk about what kind of histology they have and what we know about that. And if they're asking for immunotherapy, I think it's helpful to introduce PD-L1 testing, explain exactly what that testing is. And I'll talk about how we often get that test back first, and how immunotherapy can be a really good treatment option for lots of patients with non-small cell lung cancer, unless you have an actionable mutation. And so normally when you're able to explain that if you have an oncogenic driver mutation, you typically don't do as well with immunotherapy, people are more willing to wait. I like to use the analogy of a road trip. It's not perfect, but most patients understand it. I tell them that determining their best cancer treatment is a shot we only get once. And they can imagine it like the final destination of a road trip. So if you want to go to California, I'm in Tennessee, you could hop in the car right now and start driving west. But you could also go home and pack your bag and look at some maps, and you'd be able to select a much more direct and successful route for your trip. So it may take some additional time in the beginning, but you'll likely, that will pay off with a smoother and more successful trip overall. And I think when you are able to set the groundwork, talking about lung cancer, talking about the advances in lung cancer, the importance of tailoring treatment to their specific cancer, most people are willing to wait as long as you kind of keep the communication lines open and explain your thinking.